All right, thanks so much, Natasha. Now, thanks so much for continuing to hang out with us here on NBC 23. Joining us now is someone very special who's going to talk to us about a very important topic that we need to be aware about in our community. So go ahead and officially introduce yourself and tell us what you're here to share.
Morning, Danielle. My name is Vijian Dhevan, Dr. Dhevan. I'm a surgeon here in the Lower Valley. I've been here since about 2015. I do a lot of cancer surgery.
Yeah, absolutely. You know, it's a tough subject to talk about. Of course, we all know someone who's been affected, or if not ourselves. And so there's a lot that we can know when it comes to awareness and just knowledge, self-education. So what do you think are some of the top things that people should keep in mind?
I always tell patients or anybody that is willing to listen, the first and foremost thing is early detection. There's no better thing than to detect the cancer early. When we detect it early, we can treat it, and treatment ends up being a lot simpler. If we wait too long and things get too advanced, then it still can be treated, but then it's a more involved process, and sometimes we can't cure the patient. So early detection is always the best thing.
Yeah, and you know, we always talk about how sometimes it can be a little scary to go to the doctor and make sure we're staying on top of our regular checkups, but it's so important to develop that patient and medical professional relationship, right? So what tips do you have for viewers when it comes to that?
So the one thing that I always tell people, you know your body the best. If something feels out of the ordinary, you feel a lump, there's skin changes, something just doesn't feel right, examine yourself, then go talk to your physician. Go, say, hey doc, I think something's not right, and that's the best thing, to actually go seek that medical help from your regular doctor, your primary care physician, who knows you well, who's seen you over the number of years, and they can evaluate it, and then we'll take it from there. Either other tests, and to a specialist like myself or one of my colleagues, and it's a process, but it always starts with the patient.
Yes.
Know your body, and don't try to sweep things under the rug. We as humans have this tendency to say, oh no, out of sight, out of mind.
Yeah.
Let's sweep it under the rug. Let's not deal with it. I'll deal with it tomorrow.
Right.
Deal with it tomorrow. Don't do that. If you feel that something odd, don't be afraid. Go speak to somebody about it.
Yeah, questions are important, and we're naturally, wired to have questions about things, and it's okay to ask.
Yes,
that's so important. So where do you think that we can get more information on everything that you're talking about here today? Because it is important that we do keep in mind health tips and try to live an active lifestyle that's going to support health.
There's a lot of information out there. You can go to the American Cancer Society, you can go to Texas Oncology's website, you can go to, there's just a multitude of places out there. But the best information sometimes comes from your family physician.
Wow, yeah.
They will have the best, most current, concise information without any of the misinformation sometimes you get online.
Right.
It's not that information online is wrong, but sometimes there's some erroneous information. So your family doctor, your healthcare professional, that if a serious question needs to be asked, start there.
All right. Well, thank you so much for sharing this information. It's so important. Again, sometimes tough to talk about, but so important, can help save lives of our own, of people we love, and those in our community. So we appreciate you helping bring awareness. Thank you so much.
Thank you very much. I appreciate it for having me.